Our goals in the heart failure clinic are to delay the progression of heart failure, to improve mortality, or actually reduce mortality, and then to keep people out of the hospital.
Dr. Lewis takes care of me here, and he's the one that suggested I come to the congestive heart failure clinic. I had one episode where I was really loading up on fluid, and I came to the emergency room, and they were able to get the fluid off right there, but he came over and said, "You got to go to the congestive heart failure clinic." I can't thank him enough. Best thing that he ever recommends, really.
It is a chronic disease process that it is manageable. There are multiple interventions. We have pharmacologic interventions, we have non-pharmacologic interventions, and there's lots of resource for patients. Education is a huge component to help patients manage their chronic illness.
The actual treatment that I've received here is backed up by a cardiologist here that specializes in congestive heart failure, and Susan's in constant contact with him. After I finish an exam with her, she calls him. If there's an issue, he comes right down and takes care of it for me.
We have nurse practitioners, we have a pharmacist, we have a dietitian, and then we have a cardiologist that helps us and is always available to help us with more difficult patients to manage.
One thing I've noticed about the congestive heart failure clinic, they can pick up on a problem before it becomes a major problem, and if you didn't come here and it became a major problem, you would end up being in the hospital.
See patients on their initial evaluations when they're getting discharged out of the hospital, so there's a transition of care component. We implement guideline-directed medical therapy per the American College of Cardiology and the American Heart Association. We are very aggressive about educating our patients and their caregivers so they're empowered and they can anticipate what to expect to occur down the road. One of the resources that we fortunately have in this outpatient setting is we can give them IV Lasix if it's determined that they have an acute decompensation episode. We can try and stabilize that condition, and that keeps them out of the hospital. So that's a beautiful thing too.
And I think it really fills a necessary need for patients with congestive heart failure that wasn't really addressed on any other level. I mean, the cardiologists can do so much, but they need someone that sees you very frequently, and not, it would be unreasonable to expect them to. So I think the fact that we have this clinic here is a really phenomenal advantage for the local people that have congestive heart failure.